Chapter 8, Communication Disorders. So within this chapter, we're going to identify four major functions of communication. We're going to describe the characteristics of communication disorders, explain why the number of children with speech and language impairments is much higher than the number of children who receive special services under the speech and language impairment category. We're going to describe and identify speech and language impairments, list the major components, identify basic goals and elements of speech and sound errors, and lastly, we're going to explain how speech and language pathologists have a special role in communication disorders. So let us begin with the definition. Four major functions of communication include narrating, explaining, and informing, explaining and informing, requesting, and expressing. Communication is the interactive exchange of information, ideas, feelings, needs, and desires. So, as we spoke about the four functions of communication, let's start with narrating. An example of narrating occurs when children are able to tell a sequence of related events connected in an orderly, clear, and interesting manner. Explaining and informing involves children interpreting explanations of others in speech and writing and putting what they understand into words so their listeners or readers will be able to understand. Number three, requesting occurs when children communicate their wishes and desires to others in socially appropriate ways. And lastly, expressing allows children to express their personal feelings and opinions and to respond to the feelings of others. Language is a formalized code that a group of people use to communicate with one another. The five dimensions of language include phonology, morphology, syntax, semantics, and pragmatics. Language disorders involve problems in one or more of these five dimensions. And also, language disorders are usually classified as either receptive or expressive. With phonology, that involves a combination of sounds. Morphology includes how sound blends into words. Syntax is the arrangements of words, typically in sentences. Excuse me. Semantics is the vocabulary or the meaning of words, and pragmatics is the social use of language. Now, when we get into dialects, that's when we have different patterns of speech and language that are appropriate to particular families and communities or regions of the world. Speech is the oral production of language, and there are speech sounds that are a product of the four related processes: respiration, phonation, resonation, articulation. Respiration involves the breathing that produces a sound. Phonation includes the production of sound by muscle contractions in the voice. Resonation, sound quality shaped as it passes through the throat, the mouth, and sometimes the nasal cavities. And articulation, a formation of recognizable speech sounds. Most children follow a predictable sequence in the acquisition of speech and language skills. Children between the ages of 11 and 36 months, which is usually a year to 3 years old, they're exposed to a tremendous amount of spoken language. Children who are learning to talk practice their new skill relentlessly, which comes to mind the saying, bridging the 30 million word gap. This is a reference to the vast difference in the number of words that some children from poverty backgrounds or poverty-stricken backgrounds hear by the age of 4 years compared to what the experiences of more affluent children. So this 30 million word gap, children by the age of 4 should already have 30 million words in their repertoire. But due to poverty and other environmental factors, there is a gap, there is a lack of word recognition. The American Speech and Language Hearing Association, which we term ASHA, has a definition of communication disorders. They define it as an impairment in the ability to receive, send, process, and comprehend concepts or verbal, nonverbal, and graphic symbol systems. IDEA has a definition which states a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely, there's those two words again, adversely affects a child's educational performance. You will notice that IDEA uses this phrase for all of their disability categories. The disability has to adversely affect a child's educational performance. Speech impairments. Speech is impaired when it deviates so from the speech of other people that it calls attention to itself, interferes with communication, and or provokes distress in the speaker and the listener. There are 3 basic types of speech impairments, which are articulation disorders, errors, fluency disorders, and voice disorders. Articulation disorder errors is the production of sounds, have an error in the sounds. Fluency disorder involves difficulties with the flow or the rhythm of speech. And voice disorders involve problems with the quality or the use of one's voice. Language disorder is impaired comprehension and or the use of spoken, written, and or other symbols. Language disorder may involve any combination of phonology, morphology, and syntax, semantics, and or pragmatics. There are 4 basic kinds of speech sound errors, and they are distortions, substitutions, omissions, and additions. With distortions, the speech sound occurs when it sounds more like the intended phenome than other speech sound, but it's still wrong. Sounds like it, but it's still incorrect. You're distorting the sound. Substitutions occur when one sound is substituted for another. An omission is sounds are just taken away, and additions, extra sounds are added to make comprehension difficult. So we have articulation disorders. This is when a child is not able to produce a given sound physically because that sound is not in his or her repertoire. And then we have phonological disorders where a child has the ability to produce a given sound and does so correctly in some instances, but not others. So we have some fluency disorders, which is an interruption in the flow of speaking characterized by an atypical rate, rhythm, and repetitions in sounds, syllables, words, or phrases. Another characteristic is a voice disorder, which are problems with the quality or the use of one's voice. Language disorders involve problems in one or more of the 5 dimensions of language, and language delays implies a child is slow to develop linguistic skills, but acquires them in an atypical sequence. Language disorders suggest a disruption in the usual rate in which language skills should emerge. Now we have prevalence. So back in 2013, there was approximately 50% of children who received special education services because of another primary disability, such as intellectual disability, learning disabilities, hearing impairment. However, they also were diagnosed with a communication disorder. Communication disorder is the second largest disability category under IDEA. It approximately is diagnosed in boys, and the percentage of children with speech and language disorder decreases significantly from the earlier to the later school grades. That is an interesting fact. Speech and language impairment may be organic, which means it can be attributed to damage, dysfunction, or malformation of a specific organ or part of the body, such as a cleft palate or paralysis of the speech muscles, absence of teeth. Most communication disorders, however, do not have a known physical origin, or its origin is unknown and are classified as functional. Factors that contribute to language disorders in children may include developmental or intellectual disabilities, autism, traumatic brain injury, child abuse and/or neglect, hearing loss, and structural abnormalities of the speech mechanism. Some severe disorders in expressive and receptive language result from injury to the brain. Research indicates that genetics may contribute to communication disorder, and also they're considering environmental influences may play an important part in delayed, disordered, or absent language entirely. So the first line of assessment involves universal screening and teacher observations. If a child is suspected of having a communication disorder, a speech language pathologist, otherwise known as an SLP, conducts more systematic tests. A comprehensive evaluation to detect the presence and extent of a communication disorder would likely include the following components: a case history, physical examination, articulation and hearing, a physical examination, phonological awareness and processing tests, and observation in natural settings, to name a few. We assess language proficiency in both the first and second language of a child, especially when we're trying to determine culturally and linguistically different child's communication competence. We do not diagnose with a speech language disorder if problems are observed in only English and not in their first language or dialect. We include assessment of basic interpersonal communication skills and cognitive academic language proficiency, An assessment for the purpose of identifying children with disabilities are required by IDEA to be conducted in the child's native language. A general goal of specialists in communication disorders is to help the child speak as clearly and pleasantly as possible so that a listener's attention will focus on the child's message rather than on how it is said. The goals of therapy for articulation problems are acquisition of correct speech sounds, generalization of the sound to all speaking settings and contexts, especially the classroom. And lastly, the maintenance of the correct sounds after therapy has ended. So again, that generalization is meaning how is the child transferring what was learned about the speech to other settings, classroom, home, community. And that maintenance of correct sounds is how well is that child holding on to the new therapy or the intervention? Is it a part of their daily life now? Or is it something learned and then forgotten? The goal of therapy for phonological errors is to help the child identify the error patterns and gradually produce more linguistically appropriate sound patterns. The application of behavioral principles have strongly influenced contemporary practice in the treatment of fluency disorders. A thorough medical examination is sought for a child with a voice disorder. Augmentative and alternative communication, otherwise known as ACC devices. ACC refers to a diverse set of strategies and methods to assist individuals who cannot meet their communication needs through speech or writing. ACC entails 3 aided or unaided components: a representational symbol or set of vocabulary, a means for selecting the symbols, and number 3, a means for transmitting the symbols. Symbol sets and symbol systems for ACC, selecting the symbols and transmitting the symbols, are all a part of the augmentative alternative communication system. So now we go lastly into placement options. To SLP, which again stands for the speech and language pathologist, she or he is the person whose primary job is to provide therapeutic services. They range from primary service provider to consultant, depending on the nature and setting of the intervention. They provide services structured from one-to-one drills and pull-out sessions and group pull-out sessions, natural language context, either the home, community, and then they can have collaborative consultation in a classroom-based setting. Many SLPs believe it is important to adequately serve a child with a speech or language impairment with an isolated pull-out approach, because communication is seen as occurring most meaningfully in a natural environment. Remedial procedures are increasingly carried out in the general education classroom during ongoing routines rather than in a special speech room. And that concludes Chapter 8, Communication Disorder.